If you have hereditary angioedema, or HAE, take a moment to learn about the first and only plasma-free C1 esterase inhibitor for the treatment of acute HAE attacks in adults and adolescents. Whether you have started experiencing the symptoms of HAE for the first time, or you've been living with it for many years, it's important that you understand HAE and have a plan to manage it. HAE is a rare disease that occurs in about 6,500 people in the United States. HAE is caused by a deficiency of C1 inhibitor, a protein found in the body. Fortunately, there is an effective state-of-the-art recombinant technology treatment that may help, called Ruconest. Prescription Ruconest is the first and only plasma-free C1 inhibitor for the treatment of HAE attacks. C1 inhibitor is normally found in our blood. Patients with HAE, however, have a low level of functioning C1 inhibitor. An attack begins when certain proteins and enzymes that are normally kept in check by C1 inhibitor become activated. Eventually, because there is not enough C1 inhibitor available, this activation leads to the production of bradykinin, which causes fluid leaking out of the blood vessels and into the tissues, a condition called angioedema. Ruconest works at the root of the problem, increasing functional C1 inhibitor levels into the normal range to block each link in the chain to stop an attack. In clinical studies, patients taking Ruconest started to see symptom relief in 75 to 90 minutes. 9 out of 10 patients in clinical trials successfully stopped their HAE attacks with just one dose of Ruconest. With a single 50 IU per kilogram dose, the highest intravenous dose of C1 inhibitor, Ruconest raised functional C1 inhibitor levels within the normal range in more than 94% of patients. Most patients taking Ruconest were symptom-free for at least 3 days. Talk to your doctor today to see if Ruconest may be right for you. In 7 clinical studies, the most common side effects that patients experienced were nausea, headache, and diarrhea. Of 250 study patients, 5 had nausea, 19 had headache, and 5 had diarrhea. What is Ruconest? Ruconest is an injectable medicine that is used to treat acute angioedema attacks in adult and adolescent patients with hereditary angioedema, HAE. Who should not use Ruconest? Do not use Ruconest if you have experienced life-threatening immediate hypersensitivity reactions, including anaphylaxis, to Ruconest or to any other C1 esterase inhibitor product. Call your healthcare professional or the emergency department right away if you experience wheezing, difficulty breathing, chest tightness, lips and gums that turn blue, fast heartbeat, swelling, faintness, rash, or hives. Do not use Ruconest if you have a known or suspected allergy to rabbits or rabbit-derived products. If you do not have a known rabbit allergy, testing is not required. Ruconest is not indicated for use in children under the age of 13 years. What should I tell my healthcare provider before using Ruconest? Tell your healthcare provider about all your medical conditions, including if you have a known allergy to rabbits. Tell your healthcare provider about any other medications you are taking, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. Also tell your healthcare provider if you are pregnant, breastfeeding, or planning to do so. Ruconest has not been evaluated in pregnant women or nursing mothers. You and your healthcare provider will decide if Ruconest is right for you. How is Ruconest given? Ruconest will be dissolved in sterile water and slowly injected into your vein. What are the possible effects of Ruconest? The most common side effects patients experience during clinical studies include headache, nausea, and diarrhea. These are not all the possible side effects of Ruconest. If any of the side effects get serious, or if you notice any side effects not listed here, please inform your healthcare provider or pharmacist. You can also report side effects to the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. For product information, please please contact Pharming U.S. toll-free at 844-474-2764. For adverse events and product complaint reports, please call 800-930-5221. Please visit www.ruconest.com for full prescribing information, including patient product information.